Okay, here we go. Spinal. Okay, hi, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. You're laying on your side. Everything you see is magnified 30 or 40 times on the screen. Um, this is a gray cannula coming in the front through a part of the shoulder called the rotator interval. Here's the biceps tendon, which is partially torn. We're going to pass a suture through it just to try and secure it. So there's our needle coming through. We're going to pass a black wire called a super shuttle through it, and then we'll pass a suture. Super shuttle. Do you have the actual scissors? Not these. Are these? Okay, so we're just cutting the biceps anchor here. You can see we've got a suture passed around it. Okay, and now that biceps is released and hopefully won't cause any more pain inside the joint. We're going to go ahead and put our shaver in next. And have a look around the rest of the shoulder. We're going to first, can you plug in or turn on the shaver, please? Okay, so we've got our shaver working here. Lift straight up on the shoulder. So I think that looks pretty good down there. You can see you've had some cartilage loss in the inferior glenoid region. Okay, so now we're going to look up, and this is the rotator cuff tear here. And this is where we're going to be putting in a suture anchor to reattach this back to the bone. Can you turn my cannula to high and the shaver to high on the Arthrex pump, please? Okay, so we're going to go ahead and go off on the video for now on the pump. So there you can see the biceps tendon anteriorly. This is the tear. You can see the articular cartilage there. And with this guide, we're going to place our first and probably our only anchor down right about here. So we'll go ahead and pull the obturator and put in the anchor and gently tap that down. Okay, start gently. Okay, hold on. And now we'll go ahead and pull the anchor back. Okay, so there you can see our anchors down with our sutures. We'll reach in from the front here. Hold the cannula, please. Look on the screen so you can see it. Relax. Yeah. Okay, hold the cannula right about there. Okay, and so now we're going to take a suture hook, straight crescent on the left, and the grasper to Garth. And we're going to be passing our first stitch basically in this direction. Hold the camera here and I'll take that. So we'll look underneath. We want to make sure, sorry, Garth. We want to make sure we get this deep layer. You can see it there. And there it is right there. That looks like a good stitch. So we'll go ahead and feed that through. Hit the pause, long push. Okay, go ahead and load. Don't let this back out. Okay, so we're going to slowly pull back. Look on the screen. Okay, yeah, there. Okay, and so now we've got that suture coming underneath, just like that. And out here it's coming out there, so we'll go ahead and take our crochet hook and get the partner suture here, just like that. And so we'll go ahead and leave that for the moment. We'll get the next suture in line. I think we'll just take this blue and white one just like that. Now we'll take a slightly different angled hook, grasper to guard. Okay, just hold the camera here. 2 hands, yep, got it. And there it is. Come push in just a little bit. Push straight down just a little bit. We'll go ahead and retrieve that there. Hold the cannula. Okay. Pull back on the cannula a little bit. Great. Okay, so that looks good. Pull this here. That's dirty down there. So if you, that's.
Pull what?
Hold this. That's dirty down there. So hold that, please. So we'll pull. That's going to take that stitch with it. That looks good. We'll get the partner blue and white suture here. And then in just a minute, we're going to use a turn to the left suture hook. First, we're going to take these outside. Just like that.
You do that just to hold the suture.
Okay, so we've tied off the rotator cuff sutures. You can see the black and white one, the blue and white one, and there's a solid blue one. The second solid blue one is for the biceps tendon. You can see how that spans the interval tissue in the front to secure the biceps. And so as we rotate, let me focus a little better. As we rotate, everything looks good here. We're going to finish up and get you back to the recovery room shortly. Good luck to you now. Bye-bye.